Okay, so we are actually trying to look at the next concept here, and this next concept is trying to identify, okay, a patient came to you, you are suspecting that the patient has issues with their kidney. So as you are suspecting that the patient has issues with their kidney, you are trying to interview this patient and get some information from this patient. So that's what we call a medical history taking. So for people that have acute kidney injury, what are the questions you might actually want to ask them? Because this is more of like an interview. Okay, so for acute kidney injury, we said that taking a medical history for a patient with acute kidney injury is a critical step. You are trying to identify what caused the issue, okay, and this will now help you to be able to go on rightly with the type of investigations you should do, and also the type of treatments you should initiate in such a patient. So key areas to explore in history taking is we are trying to pinpoint if there's decreased urine output. We are trying to now see if the child, because there's decreased urine output now, the child has what? A backlog of fluid in the body, because literally your urine is putting out the fluid from the body. You are trying to see if the individual is weak, if there are swellings in parts of their bodies, okay, the shortness of breath, confusion or altered mental status. Then you are trying to look at how it actually started. You are trying to look at the duration of symptoms. You understand? Okay. So fluid status and intake. So you are trying to see if they have recently vomited, if there's excessive sweatings or burns, if there's use of diuretics or other medications affecting fluid balance. So for your medical history too, you are trying to pick up if they have taken anything lately that's affected the kidneys. All right, any drug that's affected the kidneys of lately, you are trying to also pick it up. Then infections, you are trying to see if they have had any infections recently that will be of concern. Then you come down to the kidneys and see how their kidneys are doing by trying to know how, the kidneys are putting out urine, the frequency, the urgency, okay. If there's blood in urine, there's flank pains or lung tenderness, if there's history of kidney stones or urinary tract obstructions. You also check out for their past medical history to see if they have ever had any issues. That's any issues at all. This one you are not being specific to. This one you're not being specific to the kidneys only. You're just looking at the system. Have they ever had any issues that are actually concerning? Okay. The family history, you are trying to see if there's any history of kidney injuries running up in the family. The social occupational history, you are trying to see if they have been exposed to toxins. You are trying to see if they take alcohols or drugs and all of that. Okay. So for what we have here on the next, okay, so clues. Now this is what will give you a clue to know which region that disease condition is actually occurring. Please, you can pause to look at the clues because it's kind of tricky. You have to reason it out. Okay, so that's what we have here for the history taking for a patient that has acute kidney injuries.